Good morning, everyone. Thank you for coming along today, and welcome to MIDAS's session today on the methodological subgroups that it has formed. My name's Andy Clegg, and I'm the theme lead. There's Alison Doherty down there, who's our theme manager. I want to thank her for all the work she's put into setting up today, and all the leads for all the subgroups that you're going to be talking to today. Before we get into that part of the session, I just wanted to sort of give you an outline of what MIDAS is involved with. We were set up as to provide methodological guidance, I guess, to support people in developing their research, both in their proposals, to actually doing their projects, across all the different themes that are operating as part of our Northwest Coast. We also have an element of sort of training, capacity building associated with what we do, and trying to innovate different methodological areas. One really important part of the work we're involved with, we have responsibility for trying to ensure that all the projects or the work that's done, that people consider health equity within that. And so we have a very large sort of effort going into that within the theme. To tell you a bit about the subgroups, originally we set up 11. There are currently 9 subgroups operating at the moment. And they very much reflect the sort of things that MIDAS wants to do itself as well. So they're there to try and extend, create a network that's sustainable over a longer period of time to provide methodological support to all the people out there, who want to undertake research, both in supporting them do that research, bringing people together to develop different methodologies, but also to help increase capacity within that. So we set up these methodological groups, and they've been now working for, it's just over about 3 years or so. Some of them are slightly less than that. And one of the things they wanted to do was they wanted to be able to demonstrate, show to you what they've been involved with, also be able to engage you in helping to shape what they do going forward, and also to see whether you want to become members of those different groups. And you can be a member of as many of them as you like. So that's just on the slides, just illustrating the kind of things that they do. But it's to create this sort of legacy that Mark was talking about for ARC, if there wasn't an ARC 2, but generally to generate interest, not just among academics, but amongst all the member organisations who work as part of the ARC Northwest Coast as well. So, today's session, to try and decrease the amount of wittering, everyone has been set the task of trying to do the presentation, I'll stand back, presentation of 3 minutes each to show you what they've been doing and to sort of start to illuminate what they would like to do. After that, so that's about half an hour's worth, after that we're going to have tables that are allocated out to each of the groups that you can come along and talk to. And online there'll be a panel set up as well, so you can ask questions about anything to do with the methodological groups. It means that you can come and find out about them, share with them what they've done, what you'd like them to do, and then also, as I say, if you'd like to join any of them. So to give you an illustration of all the groups that are here, there are 9 groups here that cover a variety of different methodologies, and as I say, you can choose which ones you go to talk to. So they'll be all around here on the 9 tables around here. We'll be putting out those little labels to show you which they are after the teams have presented their first 3 minutes. So I think the next thing to do is to move on to the groups presenting so that I don't witter for too long. So I think the first one is public engagement and involvement. So Lucy, would you like to? And just to say, all the subgroups will come on. I won't be standing here wittering.
Thank you. Are our slides there? Oh. Fabulous. So morning everyone, it's really lovely to be here. I'm Lucy Bray and I co-lead the theme with Riz, and unfortunately Becky's poorly today, she's got the lurgy, so she's not able to join us. But we're just going to use our 3 minutes to just briefly go over what we've been working on for the last year and a bit now. So I'm just going to say firstly, we were really keen as a subgroup not to just add meetings to everyone's incredibly busy schedules, and so we thought we would just take stock and see what we should be doing, what people thought we should be doing across the region, and that they would find most useful. So we kind of started off when we first started meeting, and we did a quick online survey across the Northwest Coast to get a sense from people, what did they want from us as a subgroup, what challenges were they facing in involving members of the public in their work. And so we ran an online survey and we had some responses from academics, health professionals, some lay members, and also some third sector organisations. And it kind of highlighted some really great work that's happening across the North West Coast, but that people were facing kind of, and none of this will be new for those people that are working with members of the public, facing quite institutional barriers in managing to run PPI consultation, that they were looking for kind of networking and sharing opportunities to learn from people who are doing PPI work and what that looks like. There was a real challenge to try and think differently about how we are engaging with members of the public, to widen our inclusion and make opportunities for PPI more accessible. And also there was a real need to there was a sense that we needed to build capacity and skills across the region so that we're doing this work and building on the amazing work that we're doing already.
Morning everyone, I'm Riz and I've been involved in the subgroup as deputy lead, and as we were working together we were finding lots of, we were trying to explore different ways of networking with people, trying to explore opportunities not just through surveys. So we then decided that we were going to develop this further by a public involvement and engagement forum. So we invited lots of different academics, community groups, charity, third sector and universities to come on board and talk to us about what they've been doing already, because we can see that public engagement is across the board, it's happening already. So we didn't want to reinvent the wheel, we wanted to learn from you guys. So we invited lots of people to come and collaborate with us through our public involvement and engagement forum. That was an opportunity to, again, find out what everybody was doing and also help us to kind of see what direction we needed to take as part of our network and our collaboration and our subgroup, and that helped us to develop further into some of the work that we did in terms of our podcast that we created.
Thanks, Riz. So really a headline from that was that we knew that there was amazing practice happening across the region, but that there was a real need for kind of skills and to share that. And so we thought the best way to do that was to hold some podcasts. And so we've recorded 8 podcasts, which are all available on the MIDAS web page. And that's with academics, with some amazing ARC Northwest public lay members, just to get a sense of what are the challenges that people are facing, what does this look like for people engaging with members of the public. So there's some podcasts that are all there for people to freely and accessibly access and learn from. We're really interested in it. If anyone's interested in sharing the work that they're doing, we can add to that and add a little bit of a library of resources. So our table's at the back there. Please come and share your views about what we should be doing next. We're really keen not to, as Riz says, reinvent the wheel or add to people's very busy diaries. So please just come and quickly share your views about how we can be of most use to you. So thank you.
Right. There we go. Good morning. So my name is Lisa Newson. I'm a reader in health psychology at Liverpool John Moores University and the deputy lead on this group with Emma Bray and Deirdre Lane. Deirdre can't be with us today, she's at graduation. So we have set up the Behavioural Sciences group, and although we've been established for a few years, we've had a change of leadership, and with various things, it's been quite tricky to get this group off the ground. Partly because what is the concept of behavioural science, and we've had quite some debate in the group. We've had a bit of a network where people have joined and we've discussed what is behavioural science, and it's really an umbrella term. And what we want to do is use today as an opportunity to do 3 things. One is to invite people into the behavioural science network. The second thing is we are planning to launch a survey questionnaire that we would like to be distributed. Encourage yourselves to complete the questionnaire, but also ask you to help us to promote that across the member organisations so that we can really understand the baseline of what do people think behaviour science is? Do people really understand it? And what do they want in terms of the help and support? So behavioural science is really quite a big umbrella term in terms of thinking through behavioural medicine and health psychology, and thinking about how we can improve healthcare through looking at behaviours of what people and patients and health professionals do, and helping organisations to improve the way in which they implement that behavioural science. So we want to establish, is it a toolkit that people want? Do people want training? Do they want support with grant writing? Behavioural science is a very current topic, both around the world and in the UK, and there are funding streams coming up live. So again, this is an opportunity to think about how can we collaborate better across the network, both as academics in terms of our research aims, but also in terms of helping organisations implement behavioural science into their practices better. I've recently been elected onto the International Society of Behavioural Medicine as chair of the organisational committee, and we are looking at this actually over an international footprint. And the World Health Organization has produced a behavioural science questionnaire. It's a bit tricky in the wording, so we are looking at the World Health Organization questionnaire and we're adapting that to what do we want to establish in the Northwest. So we're much more at an infancy stage in terms of this group, but I would like to welcome you to come and have a chat with me on the table, or Emma's going to be online as well, around what is behavioural science and trying to establish what people want and to join our network. So thank you very much.
Hi everyone, I'm Yasmin Hurst. I am the current new lead of the Implementation Science Subgroup. So I think Mark almost introduced what implementation science is, and it's an important priority of ARC to help building that evidence and translating into practice, and this is what implementation science comes in. It helps us understand where, what, how, when we can implement those evidence into practice, help us understand what are the barriers and facilitators. Also, sometimes a lot of the practice is very pragmatic, so how can we evaluate that practice, make it better, optimize it, improve outcomes for patients and public benefit. And as an implementation science group, we're sort of trying to bring together everyone who's interested in those aspects. It could be for the organisations, it could be for the public, it could be just implementing a product technology for the individual. So it encompasses, a bit like behavioural science, lots of different theoretical models and frameworks and different methodologies, ranging from trials to just qualitative interviews or core design workshops. So previously, the implementation subgroup done a lot of seminars, online seminars. Sorry, I don't like online seminars. I would like to move away from that, and would like to revamp the group, figure out what the organisations really want in terms of implementation science, whether the word implementation science is very sort of, I don't know, can we change that? Do you want to change the wording? Because I think it could be a bit scary. So we would like to do some member consultations, expand the membership and do further networking, maybe speed dating about different methodologies, what people want, maybe provide training, have some knowledge exchange opportunities, and like everyone else, to support people with grant writing if need be. Thank you very much.
Hi everyone, I'm Lisa Jones. I'm a reader in public health. I'm based at Liverpool John Moores University, and I'm the chair of the Evidence Synthesis Methods subgroup, and I have a deputy chair as well, Kenny Finlayson, who is based at UCLan. So we've got an interest in systematic review methods and other forms of evidence synthesis, and also the different methods of doing evidence synthesis, the different tools and the technologies that can support us to use these methods. And evidence synthesis is a really important approach because it enables us to learn from research that's already been done. It can help us identify gaps in the research evidence as well and help us reduce research waste. So it's got quite a wide application across many different areas of health. So the aim of our subgroup is to share our knowledge and expertise across the range of different methods and use that to support the work of ARC North West Coast. And been running for about 3 years now as a group. We had a different chair for the first couple of years, and what we focused mostly on is working with our academic colleagues to get a better understanding of the knowledge and expertise and interests of members across those different methods. And we've had, as other groups have had, online seminars, and we've had sort of meetings as networking opportunities. But very much like you've heard from the other groups, we'd like to kind of shift a little bit of our focus and expand that range of people that engage with us. So I'd really like to hear sort of your thoughts about potential new activities or areas of engagement that we could do as a group. So be really pleased to speak to all of you about if you've got any ideas for where we can take our evidence synthesis method subgroup. Thank you.
All the way here without falling down. That was my achievement for the day. Good morning, everyone. My name's Bruce. I work at Lancaster University, and I'm one of the leads of the health economics subgroup. Economists are shy, so we didn't put our pictures up wherever it is down here. I wish we had now, obviously. But we're all here today. So Angela's here. She's not going to wave or anything, though. And Valerio's here as well, so he's waving. So Valerio's at UCLan and Angela's at Liverpool. A bit like the other groups, I know we're starting to witter a bit and repeat ourselves. We did a survey as well. We do, and one of the findings was about online seminars. So we've done lots of online seminars for our online friends. We have about 30 or 40 people come along to them, so that's going well. We also started doing some work on end-of-life care and quality of life, and we did some work on, which is ongoing as well, on discrete choice experiments, which we're very interested in. But really, the same as everyone else, I guess, what we really want to know is what to do for the next couple of years. So we're very interested in hearing what you've got to say today. It's a great day for us to actually meet people rather than online. But for the online people as well, of course, we'd like to know what you want more of as well. We've had ideas like short courses people have put to us and different things. Do you really want that? You know, do you want more online seminars? What do you want more information on from a health economics perspective? So please come along and talk to us. Talk to us online as well, and we want to just hear more about what you would like for the next couple of years. So thank you very much.
Sorry, I can't see the slides. Is my slide up? Okay, great. Thank you. I'm here to represent the ARC North West Coast Clinical Trials Methodology subgroup. My name's Gordon Prescott. I'm from Lancashire Clinical Trials Unit based at Preston. That's in the University of Central Lancashire. The other lead is Gervin Burnside, who's from the University of Liverpool. So there are many people in the Northwest interested in clinical trials, but most of them are not working in clinical trials units. So they may not have access to the national training resources available to registered trials units. We also had a lot of debate about our role and how we would fit into the other training available in the area. And we held a well-attended online seminar with a networking event as part of it. because we felt that one of the things was needed was a networking event. But we found we've lost a bit of momentum since then. And we want to make sure that when we form our next direction, we want to retain the wide diversity of interests. So that's design, data flow management and security, logistics and practicalities of trial management, statistics, government and ethics, but also things like patient and public involvement, which is becoming a much bigger part of planning a clinical trial. So as we relaunch, we have certain questions about our direction. And one of them that may have appeared on your documentation is whether we should become the clinical trials and statistics subgroup to take up those people who previously attended the statistics subgroup, which is now disbanded. And as the two leads are both statisticians, we wanted to make sure that we had inclusion, and so we feel that we're not going to do that because there's quite a lot of local provision of statistics through the Royal Statistical Society and other bodies. So we'd like to retain our current name in order to avoid putting people off who may have no interest in statistics but may have a lot of interest in the practicalities and methodology of clinical trials. Because if the practicalities aren't working, you're not going to get the data and you're not going to be able to get the results that you're interested in. So as we go forward, we're looking from today for a third person who would become a lead of this group, a non-statistician who can make sure we retain that breadth. We're looking for maybe 12 people who would form a committee who can help us shape a program. We want to design a program of maybe 3 online events a year as a first plan. So we'd appreciate any help that you can give us, either nominating yourself as a lead or helping us form that subcommittee that's going to help us shape our direction and program. Thank you.
Fantastic. Oh, thank you. Automatically done. Brilliant. Hello, my name's John Barbuck. I'm, one of the leads of the Information Science subgroup, along with my colleagues Eva Thackeray from Lancashire Teaching Hospital NHS. Is it Foundation Trust or just Trust? Super, yes. And Kath Harris, who's a member of UCLAN, and I'm not going to mention all the things that she's a member of, because she's a member of a lot of things. So yes, just to say, we're a new group that just formed for this year and a bit of the last one. And as we're a new subgroup, I just might introduce you and explain why you've got the librarians coming to your group now. So we're a group and we've formed the qualified librarians, information specialists, and other researchers who are interested in what we would call best evidence. So you're wondering what is best evidence, and the members of the evidence synthesis subgroup will probably know this very, very well. But we're looking at a larger look at what is best evidence. And the focus of the information specialist or the specialist librarian is really to supply and provide up-to-date articles, research, databases, and other guidance and books to help support other streams, other researchers. We also try and reduce bias and we increase collaboration using our resources. One thing that's really, really common now in our role is retrospective literature searching, of which one of the roles is a systematic review, which has become extremely prevalent at the moment. This helps to inform commissioning and other evidence-based practice amongst our communities. However, this requires some skills, some training in order to actually do this really well, because hastily produced literature searches or possibly less informed and biased searching can actually produce very poor quality research when it's based on less stringent research methods about literature. And so our aim is to produce a really, really healthy information scientist or information specialist community in the North West Coast. So what have we done and what are we planning to do? So one of the things we're planning to do, and we've been talking to our members, we've had a few meetings over the past year, is to look into producing a mentoring scheme in the North West Coast. There is a lot of early career professionals coming up into roles in libraries at the moment, and they're finding it, they need training, and they need assistance and support. So we're hoping to produce a mentoring scheme where researchers and librarians can collaborate and share their skills in order to improve everyone's skills in supporting researchers. We have produced a few seminars. We've had 2 seminars so far. One on searching for policy and guidance for systematic reviews, which was one thing that our members said was very interesting. And also we've done some research skills and teaching training, which was attended by a lot of librarians, and that was really popular as well. So we're hoping to have a few more seminars around about that topic. And finally, as kind of like a stretch goal, you've always got to have a stretch goal in this, we're hoping to look at something that's being done in similar groups in other regions, and that is produce guidance for Northwest Coast focused searching. And this is a sort of search bank of how do you search for evidence in the Northwest Coast? Because what is the Northwest Coast is a question that we've been asked a lot in my role, and I'm from Lancaster University, by our researchers. And it's something where we can provide a really focused searching on Northwest Coast issues and Northwest Coast locations to help researchers better focus their research. So thanks for listening to me. I hope I've kept to time. If you want to come and have a talk to us, we're going to have a table as well, where you can come and talk to librarians and information specialists and clinical librarians, which we have here, and find out about the work we've done and where possibly we can help you. Super. Thank you very much.
Thank you very much. So the Complex Interventions Group, the group is actually led by Neffin Williams, Professor of Primary Care at the University of Liverpool, and he's supported by myself and Zara Quigg from Liverpool John Moores University. So the Complex Interventions Group, essentially we've done a lot of work which has been very much structured around the MRC Complex Interventions framework. So that's principally involved looking at the core elements of what's involved in a complex intervention, the development of an intervention, the feasibility of an intervention, implementation of the interventions, and how you've then go on to actually evaluate that intervention itself. So we've done a lot of scoping work around the expertise that sits within our footprint and mapping where that expertise sits relative to this framework. We're hoping to have some more series of seminars around complex interventions in the coming months and years. What we would really like to do is we're very aware that a lot of our work overlaps with that of a number of the other MIDAS groups. So we'd very much like to reach out to the other MIDAS groups and see where there's opportunities for holding maybe joint seminars and symposiums as well. So if you would like to get involved, please do get in touch with us. We've been able to offer lots of support in terms of expertise for supporting people with grant writing and some of that methodological expertise where it's required. Thank you.
We're here today to give you a very brief overview of our qualitative research subgroup and the kind of work we've been doing. We've been through quite a lot of changes in the past year or so, and we're going to give you a little update too.
My name is Kirsty Coxon, and I'm a co-lead for the group along with Claire Maxwell. I'm based at the University of Central Lancashire, and Claire's at Liverpool John Moores. Claire and I are new co-leads of the group, and we know we're standing on the shoulders of giants. Our predecessors, Sue Down, Lorna Porcelato and Suzanne Hodge, who led it to this point. We would be lost without the administrative support of Sarah Allen, and our team has around 50 members. We cover all of the ARC universities, and we link in with a lot of other methodological subgroups. We wanted to say a bit about how we link in with the other MIDAS groups, and here we've picked out the themes that we think we're most closely related to. We have a lot of overlap with the evidence synthesis group, many of whom do qualitative and mixed method synthesis with international impact. Implementation science, behavioural science and complex interventions are clearly closely linked, and qualitative studies often contribute valuable insights to all of these areas. We think it's maybe useful to say what we don't do as well. We're sometimes called upon to provide training in qualitative methods. This isn't within our group remit or scope, but we're happy to signpost people towards the many excellent training resources that are available. We don't generally provide one-to-one support, but we will be signposting people to the new NIHR research support services, which many of our ARC partners are providing.
Finally, these are some of the many ways we contribute to the MIDAS aspirations of innovation, development and adaptation in research methods. We have the annual Hermeneutic Phenomenology online course, which has really grown. It has international participation now, from doctoral students to experienced professors. The course alumni are creating impactful research in health and social care all over the world. We have an annual networking event which brings together our partners in the NHS and our group membership. Our qualitative research has pushed methodological developments in qualitative metasynthesis and implementation science, in process evaluations, in narrative and lived experience, and ethics in practice. We'd like to invite you to reach out to us and get involved. We're really keen to collaborate across ARC and within ARC research. Thank you.